Good afternoon. I'm Rick Christie, Executive Editor of the Palm Beach Post. Thanks for joining us again today. After a rough start, Palm Beach County residents are now being vaccinated at a pretty good daily clip against the COVID-19 disease, somewhere north of 20,000 shots a week, I believe. Things appear to be going so well on the shot front that the eligibility age fell to 50 on Monday and will fall to 40 next Monday, and then to 18 on April 5th, Governor Ron DeSantis announced this morning. As vaccinators prepare for the onslaught of another several 100,000 eligible residents, euphoric Palm Beach County residents who are already fully vaccinated are eager to finally get out, hug, and huddle. But how should they conduct themselves now that they have been inoculated against a disease that has killed more than 33,000 and counting of their friends, family, and neighbors across the state? Today, we're addressing these COVID vaccination questions with Dr. Alina Alonso, Director of the Palm Beach County Health Department, who has emerged as one of Florida's most respected voices on handling the COVID pandemic over the past year. Now, let me remind those who are watching that this is meant to be participatory. So we want to hear your questions and hopefully get them answered. Just leave it in the comments section and we will try to get to it. And again, thanks for being here. So Dr. Alonso, let's start with, how would you describe the state of the pandemic in Palm Beach County?
Well, I think we're doing relatively well in Palm Beach County. I think the thing that we have the most support of is the residents. The residents have been listening to our advice. We've been following the CDC guidelines, and there's a high demand for the vaccine. That is a very good thing. That means people want to get vaccinated. In other counties around the state, there's very low participation. So that's good for Palm Beach County.
So what's the latest on how the vaccine is being distributed here right now, would you say?
Most of the vaccine is going to the pharmacies, and the federal program is depending on the pharmacies to really carry the load for people across the nation. The federal pharmacy program under the president, that is the hope. And we are support that because obviously the health department, the public health system starts this as an emergency, but then we back out and we let the local entities actually do the rest of the work, right? So we are hoping to get more vaccine. At this point, our allotment of vaccine has not increased despite the increase in the number of people that will be asking for it starting in April.
Oh, okay. But how many sites are up and running now? And I know you mentioned something about the pharmacies, certainly. I guess that's Publix and CVS and, as you mentioned, Walgreens and those guys. How many, I guess, government-run sites do we have up now in Palm Beach County?
The government-run sites are basically the healthcare district and the health department. We have one site, which is in the Lake Worth Road. That's the Mid-County Senior Center. And then we have another site out in Belle Glade at our C.L. Brumbeck Health Center that's been there for many, many years. And we are vaccinating out of that site. The healthcare district has 3 sites, one at the Civic Center down in the south end. We have another one on the north end on Burns and Military Trail. That's the Palm Beach Gardens Community Center. And then we have the mass vaccination site at the fairgrounds that can really hold a lot more people and see a lot more people than what we're seeing now. But our vaccination has only been about 5,000 to be shared between the two of us per week. So the big amount of vaccine, the 20,000 plus, is going to those pharmacies that are doing the mass vaccination in Palm Beach County.
Oh, wow. Okay. But it sounds like we do have enough vaccine to inoculate those who are eligible right now?
No, we don't have enough vaccine to inoculate everybody that wants the vaccine, because there's a lot of people still can't get through, and there's still, there's going to be a lot more demand. We're basically going to add another 1 million people now to the demand with the same supply. So Supply and demand definitely is going to make this a little bit. We are, expecting to see more vaccine coming down, more vaccine coming to the president's plan is to have over 40,000 pharmacies included in giving out. They're going to include all pharmacies,
Wow.
The private pharmacy. Also, the other thing that we're hoping for is that the providers start getting their vaccine allotments that they were supposed to get, and that would help the doctors be able to give out to their patients.
Oh, right.
In addition to that, we have right now 4 sites that are state-run sites. That's the one on Pahokee, Wells Recreation, Gaines Park, and the one down in Boynton, Ezel, the church down there that is.
Okay.
So those are being supplied with state vaccine. So that's one of the things that we've done in order to increase the amount of vaccine. We haven't gotten it for ourselves, but we've been able to convince the state to give us some of these additional sites. Those were chosen specifically along after we did our map. Well, without doing the map, we know where our communities are that are the hardest hit and the ones we have to pay most attention to. The map just verified what we thought, and that's why we did the map. That map's on the Palm Beach County gov.org site, where the county is keeping that. It's interactive, and it can actually show you where all the vaccination sites are, all the publics and the state, as well as any federal sites in the future that we would get. So far, we haven't got any of those.
All right, so we'll try to post that website and link in our comment section too. So thanks for letting us know about that. But I'm glad to see that folks are already asking questions here. So again, so I was about to remind people to be that this is participatory. We want to get your questions, but we have several up here already. One quick one from a Dan Scapuzio, who is he's after receiving the first dose. How safe are you?
You're probably. It takes about 30 days for your body to start creating those antibodies. The reason it hurts in your arm is because your body is working. So that's a good thing. If you're hurting a little bit and you have a little fever, that means your body's working, making antibodies. It takes about 30 days. So after that, you probably have about a 60 to 70% coverage. What we don't know is how long will it last. And so in order to get up to the 95%, you need that second dose.
Okay, which is like within 21 days or something like that, right?
Pfizer, 21 days, Moderna, 28 days. It's simply because that's how they did the study. There's no magic numbers. And of course, Johnson & Johnson is just one shot.
Okay, all right, thank you. So let me ask then, are there clear CDC guidelines for folks who have been fully vaccinated?
Yes, in terms of their interaction. Now, it's very important. The first thing I'm going to say is you still have to be careful. You still have to wear your mask. You still have to wash your hands. You still have to distance, because even with that high effective rate of this vaccine, it's 95%. The regular flu is about 60%. Okay, so this is a very, very effective vaccine, but that 5% means you can still get breakthrough. You're not going to go to the hospital. You're not going to die. You're not going to go on a ventilator, but you can still catch the flu. And our big concern that our entire CDC and all the medical people are afraid of is that with these variants, these mutated viruses that occur all the time, this is normal, that become the predominant, then that might affect the effectiveness of the vaccine.
Oh, wow. Okay. Let me try to ask another one of these questions here. Well, one of our Linda Elliott Wilson is concerned about, it seems to be concerned about the fact that there are a lot of people 70 plus who have not yet been vaccinated. So dropping the age, will that be affected by the eligibility age being lowered the way it has been?
Yes, we still have people 70 plus that are still waiting and have been, unable to get the vaccine. So now they're going to be in the same group as everybody else. This is going to be a mad dash for vaccinations. So we're going to
Wow.
have, at least, I mean, think of it. If we open it to everyone above the age of 18, our population is 1.5 million people. We have vaccinated, a good chunk of folks, but 74% of the population over the age of 65 have been vaccinated. But that leaves another million people now. They're all going to be scrambling to get the vaccine. So that individual that's still trying to get the vaccine for whatever reason is going to be competing with everybody else.
Is that million number you mentioned, that again, that's a statewide figure?
No, that's here in Palm Beach County. We got 1.5 people living in Palm Beach County.
Okay.
So if I take away those under the age of 18, I mean, I haven't done the calculations myself, but I'm just estimating that it's a whole bunch of people.
That's a lot of people.
Okay. A vaccine that we have, like you said, it's a little bit over 20,000 vaccines that we're getting into Palm Beach County a week. So that supply and demand is definitely not equal at this time. There are counties outside of Palm Beach County who have very little demand. So for them, this is going to be great. They're going to be those people are going to be coming through really quickly and be able to vaccinate. But Southeast Florida still has a very high demand for vaccine. And so this is going to be a struggle for the next few weeks, for sure.
Oh, wow. Okay. So let me go ahead and ask another couple of questions after you've been fully vaccinated. And hopefully these are quick. Am I allowed to have gatherings at my home?
The CDC guidelines are very clear that you can feel safe within your bubble of your family members have all been vaccinated. The grandparents want to come over and see the kids.
Yeah.
They've been vaccinated. Don't make the mistake to think that you're all safe. Why? Because the moment you go outside of your home and you're in contact with people that have not been vaccinated, you stand that 5% risk of becoming positive.
Okay.
And you can spread it. You can still spread it. Now, you're not going to die. You're not going to have to go to the hospital. You're going to survive this, but you can still spread the virus. So we still have to use the precautions. And that's what I'm afraid of, that everybody thinks they're Superman. And I felt it. I got the vaccine. And when I got the second dose, I felt like that 15-year-old that wants to go and party.
Yeah.
Okay? I really felt it, and I really had to hold myself back and say, okay, Alonso, follow your own advice and be a good patient and don't go out there and get crazy, because even though I got the vaccine, I still have that 5%. So we still have to wear a mask, wash our hands, and keep our distance.
Okay.
You're safer within your own group, but the moment you go outside, you're still can get the virus.
All right, got it. So that's when I'm thinking, the next thing I'm thinking about is, grandparents who say, oh, I can finally go hug my grandkids, because it's been a while for a lot of them, and so your message to them is be careful. You should still wear a mask.
Still wear a mask, especially if you hug the kids, but you're much safer than you were before. So yes, that is true. And I think that's a family discussion you all have to have. Because when you as a grandparent go to that home, you need to know who's coming in and out of that home. And just because you know them does not mean that they're safe. If they have young or old, teenagers that are going out and they're doing things that parents don't always know that they're doing, you have to be careful. So you yourself have to be careful, and you have to make sure that you're not taking a virus with you because you went to the store and you happen not to have your mask on that day, perhaps.
Okay. Let me go back to this, because I'm trying to remember if you answered quickly on this too. Does the vaccine protect me from getting sick from COVID?
You can still get sick, but you're not going to have to go to the hospital. In other words, you're going to have a mild case. You're going to react more like that 15, 16-year-old that gets infected and has maybe a little bit of fever, a little achy, but continues to go out and spread the virus.
Oh, okay. All right. And then one person also asked, and you already said that we don't know how long the vaccine's immunity lasts.
Right.
We don't.
We do not.
I'm sorry.
We do not. And that's because we haven't had time to study this for a whole year to find out, is it going to last a year like the rest of the SARS vaccine, the flu shot? That's why we get it every year, because it lasts about a year and a half. And so we get it every year. We have to prove that by having millions of people across the globe test and check for that. And we expect that it will act like the regular SARS virus that it is.
Okay. Someone else asked, why do I need to get the vaccine if I've already had COVID? Should I already have some immunity?
You do, but because we don't know how long it lasts, we're saying go ahead and get another booster just to make sure. Now, there's some thoughts in the countries that maybe you only need one booster, but right now they're still saying two. And the other issue is you should probably wait like 90 days, because right after you're sick, you're going to have lots of antibodies. So if you want to wait maybe 90 days and then get vaccinated, so that booster spreads you out longer for longer protection. That's a thought. You don't have to. It's something that you can do.
Okay. So let me put up another one here from a commenter, Bernadette Asunta. Says a healthcare worker in direct contact with COVID patients cannot, well, just for some advice on where to go, cannot find the vaccine. Please help. Works in Palm Beach County at a hospital. Please help.
Well, the hospitals have been getting vaccine. So I would definitely talk to the hospital. And I mean, I guess she has. But right now you are able to go anywhere to get the vaccine, get on the list, get on the Publix list, get the healthcare district. They have a new website that's going to be released on Friday, and right now it's down, but it will be released on Friday, and you'll be able to pick where you want to go.
Wow. Okay.
So as a healthcare worker, you are in the group that can get vaccinated. So you have to have some kind of proof of where you work. If you work at the hospital, obviously you have a badge. If you're a nurse, it'll say nurse. If you're a phlebotomist, something that shows that you are in direct contact. You can get your supervisor or somebody, if you're in a different situation, of what you do to make it clear when you go there that you're a healthcare worker. But I think your hospital badge will be good enough.
Okay, good. This says here, this is from the Palm Beach Post, but can you pick which vaccine you want? For example, can I find a place to only get the Johnson & Johnson vaccine?
Well, right now there's no Johnson & Johnson being given out in Palm Beach County. I think maybe some of the Publix may have some. I'm not sure. But I would do that. I would get whatever vaccine you can get. They're all very, very effective. Yes, the Johnson & Johnson is only one shot, but it's more important to get vaccinated than to wait for the one shot. We have Pfizer and we have Moderna available in the community. The Johnson & Johnson is being used by the feds for a lot of their strike teams.
Oh, okay. All right. And let's see. Let me ask something about schools because of I think this was a recent CDC guideline change or something. How should school officials, regarding 6 feet versus 3 feet, because we want to get schools open. How should school officials approach these new guidelines for school classrooms?
Well, I can assure you that the Palm Beach County School District has done a fantastic job. They're already on it. The reason for decreasing the footage is that the schools have done a lot of other mitigations, such as sanitizing, wearing the masks. I mean, they've done a really, really good job. And there has been very little transmission inside the schools. The transmission has been people outside that go out and party, go to weddings, go to things, and then they come into the school positive. We catch it, we send them home, and they quarantine at home. Some of the parents also were sending kids that were not sick, who were supposed to all be quarantining. So when we find that out, we would send them home. But the idea is you can reduce it to 3 feet, but you still have to wear the mask, and you still have to do the sanitizing, and you still have to be careful when you go to eat. you let your, if you're eating, you're now letting your mask down. So now you have to distance still the 6 feet. So it's not just 3 feet and forget about it. It's all the other things still have to be in place.
Yeah, I see some schools, actually still have like the clear barriers on desks in some cases, and I guess even the air systems, filtration systems, putting in new types of filters and stuff. Is that recommended also?
Those are all things that are extra.
Okay.
You wear the mask, you don't have to worry about any of that. But again,
Okay.
different people have different things, and things have also been allowed just for the comfort of people. For example, those little desk filters, those things really don't do anything. But if you feel more comfortable with having them there, then by all means, have them on your desk. So we're not trying to fight what people want to do. We're just making sure they do the right things.
Okay, and be safe, obviously.
Right.
So here's a couple of it. I wanted to move into vaccinations versus, because you mentioned this a little earlier too in your opening comments about variants, and because do you feel sometimes like public health officials or experts like yourself are fighting against this overall feeling of that the pandemic is nearly over, and and so how do you balance that? Because I do know that you want people to feel hopeful, right? So how do you balance that,
I'm
versus
cautiously optimistic.
you're cautiously optimistic? Okay. All right.
We are at the ending of the pandemic. Okay. But there are several things that could still go wrong. One, that we start opening things too soon, and that we have another spike. We've done that twice before in Florida, in the nation.
Yes.
And it's been consistent. We don't let that curve go all the way down. If we don't do that this time, we'll have a fourth peak. And that's been predicted by some universities.
Yes.
The second problem is the variant. And I think that's very concerning because Florida is the #1 state with the highest number of variants. We have over 1,000, mostly the United Kingdom variant, followed by the Brazil variant, and then the South Africa variant. There are other variants that are in place. And again, this is something normal. And so far, the vaccine is effective against all of them. But if we allow these variants to become the predominant virus, that changes everything. Okay. So we still have to be very careful. And those people who are not vaccinated need to continue doing what they're doing. Those who are vaccinated also need to keep doing the mask and the washing of the hands and the distancing, for that reason that they still have that 5% chance. And this variant, what makes it scary is it's not more deadly, but it spreads faster. It's more contagious.
Right.
So instead of one person getting 2 people sick, this one will get 5 people sick in the same space.
So that, saying that you should still wear the mask, you should still wash the hands, sanitize, you should still, keep distancing. It's kind of like not what people really want to hear. That we got the vaccine. Not that it's not.
I'm not your most popular person in town. I'm not confused about that.
And but it is a message. I think you keep saying that it is a message that still needs to be out there, because and everything, especially regarding another potential surge as early as April, which we are hearing from your colleagues all over the country. Let me ask, what do you about this? What do you hear of, and you may have touched on this a little bit earlier, what do you hear of side effects from the vaccines, the 3 vaccines, Moderna, Pfizer, and Johnson & Johnson? Is one worse than the other, or others? Or
no, the side effects are relatively mild. Some people have had fever for 2 or 3 days. There have been citations of some people that have been hospitalized. There's been the issue with the other vaccine of clots, but all those have been not related to the vaccine itself. Obviously, if you have the vaccine and something happens to you, you're going to automatically blame it on the vaccine. But you have to remember that millions and millions of people have gotten this vaccine, and the most common side effects are with the second vaccine that you will have a little bit of a fever. You're going to feel achy even with the first vaccine. Again, your body is making antibodies, and that's what you feel when you make antibodies. The fever goes up, the body's fighting, making those antibodies, and you feel tired and so forth. I had it. My fever went up from 96.7. I'm very, very steady. It went up to 98.8. My staff assistant was out for 3 days. She had a fever for almost 36 hours, and she felt very tired.
Okay.
So that's kind of like the scope. The site can get very red. It can get swollen and hot. Ice packs on it and Tylenol all help with that. So there's different things that different people have, but
okay.
The side effects are much, much less than getting the virus. So don't be afraid of the side effects. Be afraid of getting the virus.
Okay. And I've because people I've spoken with who have gotten it, who've had some mild symptoms and stuff afterwards, usually after the second shot, that they'll be like tired, a little spike in fever, and they'll lay down for a couple of hours or a few hours, and they're usually pretty good after that. In most cases that I've heard so far, like you said, it varies depending on the individual, right?
And we do a report. Anything that the person feels after is reported. So there's a lot of reports, but that doesn't mean it was related to the vaccine, and it doesn't mean that they had to be hospitalized or anything. People have been sent to the hospital for observation, and they've been able to leave. So there's a lot more reports, and that is, we're supposed to do that. We want to note anything that a person feels or has after a vaccine. We report it.
Oh, okay. What is that site that you mentioned that you said it was going to be live Friday again, please?
The healthcare district website for getting the vaccine. They're going to make an announcement on Friday.
Yes.
That it's going to be a little bit different than the way it is now. Right now, there's a waiting list. They're going to do away with that waiting list, and you'll be able to book directly.
Oh, okay. And so we got some other questions to our Facebook form that we put up here. So let me see. I'm vaccinated. My dentist is not. Can I go for treatment? What about dental visits at a vaccinated dentist? From Connie Spanville.
Great question. The good thing about dentists is they always have their mask on, and they use the surgical mask. So I think your dentist is protecting you by him having his mask on constantly.
Okay.
All healthcare workers, including dentists, have the opportunity to get vaccinated, and so that is something that you have to be comfortable with and discuss with your provider.
Okay.
He'll get vaccinated.
There you go. And here's one from John Hayes. Should people who are 65 plus and have had both shots, so they're fully vaccinated, should they be able to eat indoors at a restaurant?
Anybody can eat indoors now in a restaurant. What I ask and what I expect the restaurant to do is to all their employees be wearing their mask. When you get up from your table, your immediate group that you're with, that you put on your mask. You don't want to go to the bathroom or to other places and go by people that where the virus could be. You want a restaurant that's not closely packed in. If you go down to Mattis, you can look very clearly at places that you do not want to enter and places that you may want to enter. So be selective in where you go. Make sure they're following the procedures, and make sure that the people take a look when you go inside. And if you see it that it's crowded and people are sitting right next elbow to elbow, don't go in.
Okay. So I've noticed in some of your answers, a lot of it really too is your own comfort level, and if you're not comfortable, then don't,
Yes. Everything that we do is a risk. Okay. So you have that 5% risk, even if you're vaccinated. So you drive on 95, you're taking a risk every day you get on 95. So you're vaccinated, you have that 5%. As long as you keep that in your mind, I keep my mask on. I have dined in a restaurant, but I make sure that it's a restaurant that's well spread out, and that people are on top of each other. And I go with a select group that I know is being very careful, because if you're going to lunch with 6 other people and those 6 people are not following the same rules you are, they could get the virus and spread it to you while you're eating.
Okay. Just a couple of more questions because we need to wrap it up here. But I did want to ask too about the AstraZeneca vaccine and your thoughts about that, if you can. There's been some controversy around it, whereas in Europe they stopped administering that vaccine for now. In the U.S., it has not been administered yet. Is there anything that you have read or heard, talk to your colleagues about the AstraZeneca vaccine that would give you pause right now?
No, there's nothing that would give me pause. If they approve it tomorrow, I'd be happy to get it. Anytime there's any problem or any issue that comes up, it's stopped and looked at. They have to do the studies to say the clots had nothing to do with the vaccine.
Right.
People have clots and throw clots all the time. The probability of that happening and the other happening all at the same time. There's nothing in the vaccine that would make you throw a clot. So to me, scientifically, that made no sense, but it still has to be studied.
Okay.
There's also a lot of political issues and money issues surrounding all these things. So sometimes you have to be able to kind of cut through all that.
Okay.
And, if it gets approved here in the United States, I'd be ready to get it.
All right. So one last question then. It's kind of a general one, just to get your feelings here. What have you learned so far about this pandemic that you would take into the next one? And that's, of course, hoping that you're around if we have to deal with this again.
I don't want it here. Yeah, a big pandemic like this really happens around every 100 years. Pandemics themselves happen about every 10 years. And in 2009, we wrote, and when I say we, I mean nationally, we wrote a pandemic plan for pandemics that happen every 10 years. Now, so it should have happened in 2019. It skipped a year. As soon as we heard about it in Palm Beach County, as soon as we heard about it over in China that it was occurring, we immediately pulled out our 2009 plan and all the recommendations that were made in it. And we were ready to implement the national plan that should have occurred.
Okay.
That national plan never took place. The people that were put together as a unit to work on that plan federally were not there. And so things happened very, very differently from what we had planned. So my hope is that 100 years from now, when the next pandemic comes, that people learn from this one and actually do the things that we have recommended that they do, and that the CDC recommends and the World Health Organization recommends. This is something normal that happens, and we have been doing quarantine and public health safety precautions for a very, very long time. And they need to be followed, and it's the only tool that really is available to stop the spread of a new virus that occurs, and they will continue to occur because it's part of nature.
All right, Dr. Alina Alonso, Director of the Palm Beach County Health Department. Thanks for being on with us today and answering so many questions about vaccine, about the COVID vaccine and distribution. And hopefully this will all be over in the next few or several months. And but still, we'd like to have you back if we can to answer questions.
It was my pleasure. Wear your mask, wash your hands, watch your distance.
Got it. Thank you. And thank you, folks, for tuning in and with us again today. And hopefully we'll be able to come back. Take care.